A top emergency room doctor in Manhattan took her own life after treating several COVID-19 patients. The doctor's family told the New York Times she had described the grim scene of working on the front lines and had had no known prior mental health issues.
Eyewitness News reporter Shiina LoSciuto spoke with a local clinical psychologist about how this pandemic may be weighing on healthcare workers. Shiina joins us now with the story that's new tonight.
Clinical psychologist Dr. Margaret Howard says first responders and healthcare workers are used to taking care of others and putting others first. But throughout this crisis, she says it's vital for them to take care of themselves, too. It's uncharted territory, difficult to navigate, meaning it's harder to unpack the heavy emotions that come with.
The compass of healthcare providers points toward understanding disease and relieving suffering and providing hope, but the coronavirus really disregards this compass. So for many healthcare workers, the sense of failure, if you will, the guilt and the ineffectiveness in treating the unrelenting flow of patient after patient afflicted with the virus can become unbearable.
Dr. Howard, the division director of the Center for Women's Behavioral Health at Women and Infants Hospital, says we all feel the toll of the pandemic. So just imagine being on the front lines of it.
They are human, and they are battling an inhumane disease.
A disease that's claimed many lives here and around the world. Dr. Howard says both Care New England and Lifespan have support hotlines for their employees. Plus, there are several other mental health programs they can turn to. She's hopeful people will use these resources if they need to.
It is vitally important for healthcare workers who are experiencing psychic pain in the midst of their responsibilities during this crisis, that they are not alone. And healthcare workers need to find it within themselves to reach out.
Dr. Howard shares some simple advice for all of us. She says you may be exhausted, but try pushing yourself to call a friend or a family member, because she says it is very important right now to maintain these personal connections. I'm Shiina LoSciuto, Eyewitness News.